Hello class, my name is Kim Hernandez and my partner is Kendria Martin. Throughout the semester, we worked with Dr. Barbara H. and Dr. Jackie M. to conduct a systematic review over patient identity management. In this presentation, Kendria and myself will present the basis of our research. We hope that you will learn about different methods used to authenticate patients and identify current practices that are currently used in the healthcare field. For the purpose of this study, our research question was, how have healthcare organizations adjusted to the current and new forms of patient authentication? Our goal of this study is to introduce the topics of biometrics, smart cards, and referential matching, and demonstrate how healthcare providers are able to provide an extra layer of protection for their patients. Let's first discuss the importance of patient identity management and why it's such a hot topic. Patient identification is a reliable identification of the patient as the person from whom the service is intended, and it also matches the service or treatment to that specific patient. Unfortunately, medical errors take place due to patient misidentification. If we're able to correctly identify the patient at the point of admission, then this can help alleviate those medical errors. According to Johns Hopkins University, medical errors is the third leading cause of death in the United States. So we can see how this is such an important topic and why we need to find a solution that we can implement across the board to help decrease this number. This is a list of various patient identifiers and what helps make a patient unique. The first and last name, date of birth, social security number, address, and medical record number. So it's understandable how easy it can be to type in the wrong birth year, patients move, and so we have outdated data, and for instance, the patient goes in and a new record is created with their new address and it's not matching to their old address that they had on file. Sometimes those records aren't combined with one another and that patient information gets lost along the way. So it's important that we identify correct processes that will help diminish that issue. Patient identity management importance. As you will see in the next few slides, we will identify various processes that will help improve patient identity. The goal of these processes is to help reduce human error percentage and help reduce duplicate records. If we have duplicate records, it creates fragmented patient data and it can lead to redundant or unnecessary care. This disjointed data will also make it difficult for providers to make decisions about patient care. Therefore, with patient identity management, we can ensure that clinical decisions will be improved, therefore not jeopardizing the patient's safety. Patient identity management also helps decrease healthcare fraud and abuse, as you will see with the various processes. The first process we will discuss is biometrics. Biometrics utilizes various technologies to accurately identify or authenticate an individual. Various technologies of biometrics include fingerprint, iris scan, palm veins, and facial recognition. There are way more forms of biometrics out there, but we just decided to focus on these. Biometrics has the ability to reduce patient ID errors and speed up services. Imagine walking into a medical office and you don't even have to talk to the front desk. All you have to do to check in is just scan your fingerprint. You can rest assured that you're correctly identified in the system. They know that it's you and they have all of your records pulled up already. And that healthcare worker, they're going to be able to allocate their time elsewhere within the medical office, as it reduces that face-to-face encounter. The second process we will discuss is smart card technology. Patients can feel in control of their healthcare data by using a smart card to help store their personal health information. These smart cards are protected by an embedded circuit chip. It can be read and exchanged with other systems as it uses an encryption algorithm to ensure privacy. Security measures must be taken to use the card. They can enter their PIN number to allow access. Kind of works like a debit card. There's no doubt that patients receive care across multiple healthcare facilities. They could be registered differently within each system, so it's important that their health information follows them as they get care from different healthcare organizations. Smart cards are an innovative approach to help decreasing time at the patient registration session, and it helps increase patient safety. The third process we will discuss is referential matching. As previously mentioned, healthcare systems often have duplicate patient records. This patient information could be collected from many sources, such as a patient portal, registration desks, or other healthcare organizations. Referential matching is an important component of patient identity management. It helps decrease duplicate patient records as well as link these patient records. With the help of patient matching, healthcare providers can successfully link all healthcare data to the correct patient. This is done so by using demographic data and comparing it to a comprehensive, continuously updated, and highly curated reference database full of identities. Overall, this makes the process way more organized and provides accurate healthcare systems to help improve patient identity integrity. Now that we have learned about the use of biometrics, smart cards, and referential matching to help improve patient identity management, we'll move on to our literature review. These are the databases that we used to conduct our literature review. We used CINAHL, PubMed, ABI Inform, Google Scholar, and ScienceDirect. Dr. Hewitt worked with the librarian to identify our search criteria, as you'll see in the right-hand column. We used this to conduct our searches. We also made sure to specify the searches to the years 2010 to 2020. Kendria and I divided up the databases and conducted our search. Combined, we had over 150 articles. Many of these articles were removed because they related to smart card transportation and it wasn't relevant to our study. As of right now, we currently have 104 articles after the first round of elimination. We are still working on our spreadsheet and going through and reading the abstracts and eliminating any that we don't think fit within our study. So this is still a tentative number, but we will soon have the final amount within the next 2 weeks.
The next line is the benefits of a combined biometric and smart card system. The following examples are from the smart card analysis report. So one of the first examples is improved system performance and availability. So a good benefit of that is the smart card can reduce the time frame of correctly verifying a patient. So at the time of check-in, a patient can already be identified and all of their medical history can pop up on their smart card. Another one is in the case of a malfunction of the smart card, other techniques can be introduced such as facial recognition or fingerprints that are already stored on the card. So also for that is if by any chance they're having a broken finger or for any reason the system is having a malfunction and not working that day, the smart card will already have the system on the card so you can correctly identify the patient. Another one is this reduces the need for physical contact because the smart card sends the data from the card reader to an interface. So there's multiple benefits with that one. For example, right now with the COVID-19, this will decrease the physical contact between the office worker and the patient, and this will also increase the time frame as far as getting the patient out, collecting payment. Another one is this will also decrease for HIPAA violations. If the card is just scanned in, there is no reason for the patient to display why they're there or any sensitive patient information, HIPAA information. So that can also be an asset to a smart card. The next one is for the upgrades and flexibility. So a benefit with that is the upgraded system is cost efficient. So since everyone already has a smart card, there's no reason for anyone to acquire a new one. Each person is assigned one. Also, if it's compromised, a smart card does not need to be replaced. It can simply be erased and rewritten with new data. And then also another benefit is upgrades for algorithms, and you can store more memory, such as a memory card or any other applications on your card that you may need. For example, if you're a heart patient and on your smart card you can have anything that stores your heart monitoring from your device, it can store that on the card for you for whenever you go to the physician. The next one is enhanced privacy. So for that one, a benefit is it's a personal database and a firewall, and the patient can control their access. So they can control it for anyone they would like to see. So if they would like to see their physician have access, they would like their pharmacist to have access, but not if they would like their neighbor to have access. They won't be access to that. So whoever the patient chooses and trusts with it. And then also a security measure on the card is to digitally sign a smart card. So your signature will be on file, and also your identification will be on file, and also the biometrics that I mentioned before, the fingerprints and the facial recognition, and then also the photo. The next slide is a systematic review for biometrics. So this is just basically 2 articles that we pulled from our bibliography that we felt was a good example for what we're trying to convey in our review. So the first article states, biometrics can be captured in various ways to improve the patient's interactions. And a quote from that article is, our solution is to accurately capture the user's fingerprints and facial features during the initial enrollment. We introduced a touchless method using cameras and a common device such as web cameras and smartphones. The next one is, according to the article, the introduction of barcode technology has shown a dramatic decrease in medication errors. The quote that we chose to use is, realizing a 59% to 70% decrease in medication administration errors on individual nursing units, this hospital demonstrates how Barcode's point-of-care medication administration systems successfully track, reduce, and prevent bedside medication errors while having a positive effect on nursing satisfaction. So the reason that both of these articles were chosen is because they show 2 different points of views for the benefit of biometrics. The first one shows how patients can benefit as far as their interactions, how it's easy to come to the doctor, easy to get everything, get in and out, and also to just use your everyday technology that you already use, such as your smartphone. The second one is from the point of view of the hospital administration and employees. With biometrics, the medication administration errors are down. Also, this causes for more nursing staff to tend to patients and to get them the correct medication, the correct dosage, and it also serves as a great reminder as far as compliance to always ensure that the records are secure and also accurate, so to make sure that the patient is not being mistreated, and also to comply with HIPAA. The last slide is our references. So these are the references that we chose to use as far as our PowerPoint presentation. The other references that we're going to use for our paper are going to be located in the reference section, works cited section, in our systematic review, and also our bibliography is attached below. Thank you.